Hello, I am Jamie Robinson and I am a Vanderbilt General Surgery resident, and I had the opportunity to travel to Kajabe, Kenya with Hope Through Healing Hands. Although I am here back in Nashville, Tennessee, I continue to think daily about the experiences I had during my 1 month working at Kajabe Hospital. One aspect of my trip that I think about most often includes the patients and their lives. While Kajabe has the resources at the hospital, more resources than I was expecting to find before I got there to care for sick patients, so many of the patients I encountered presented with diseases that were past the point of treatment. Many had advanced cancer or pain for weeks before they presented to a physician, or extremities that weren't getting enough blood flow, and they had not come to the hospital yet. And I asked these patients, why? Why are you just now coming to the hospital to seek medical attention? And many of them said that they knew something was wrong long before they came to the hospital, but they either thought or prayed that it would get better, or they just didn't have the money because the money that they do have is for their family and caring for their children or others, or that they had no transportation to get to the hospital. And I can say that there's nothing more hurtful as a doctor to know that if you had met the patient sooner, maybe they could have had a different outcome. And I think about how that relates to the patients that I'm caring for now that I'm here back in the United States. Most of the patients I see aren't sick for that long before I meet them, as the patients here are usually fairly quick to seek medical attention after they start feeling ill. And usually when I see them for something that's curable. While I was at Kajabe Hospital, I was blessed to get to work with incredible surgeons and physicians from around the African continent and around the world. And I can only hope that more patients from Kenya get to meet these wonderful clinicians sooner, when these doctors and surgeons can make the most impact on their medical condition. So I look forward to my next trip to Kajabe, and much like I hope that the patients get to meet their clinicians that they need sooner than later, I hope that my trip back there is also sooner than later.